Hello there. Welcome. Um, this week we're doing Module 12 discussion. And the prompt is, what do you think are the biggest challenges and opportunities for social workers working in these spaces? Social workers in the mental health and in the health field in general, I feel like really help physicians and psychiatrists focus on the patient as a whole and not just the specific reason that they are seeing that patient and just, view them as an entire individual. Social workers can collaborate with physicians, nurses, psychologists, occupational therapists, caseworkers, housing specialists, and even help advocate for or be an advocate on legal matters. How they can advocate for a patient is they can help someone understand legal documents, help someone understand medical diagnoses, or just help them understand the medical or legal term jargon, make it more digestible. They can advocate for a patient's values and experiences to give them a better whole-centered care. Challenges, there could be power imbalances when it comes to, like, say, a social worker is trying to communicate specific needs for a patient to their medical health professional or a psychiatrist, and maybe they do not take what the social worker has to say to heart or of value because they, in their mind, aren't on the same level. They don't have the same education. So they invalidate what the social worker has to say. So power imbalances could be an issue. Definitely a challenge. Role confusion, not understanding what, either for the social worker or for other people dealing with the social worker, getting confused on the role that they serve, especially if they're having to dabble into different areas, dealing with legal jargon, dealing with, occupational therapist or a psychiatrist. Many could feel that maybe they're outstepping their boundaries of what, their education is. Because of, even for myself, when I started this class, I was not really fully aware of all the areas that social work actually leach into. It goes into a lot of different areas that I didn't even realize. And I feel like safe to assume that other professionals may not realize that either. Time and resource constraints. I think a lot of areas and a lot of professions right now are ran very thin. There's, a shortage in a lot of professions right now, social work being one of them. So having ginormous caseloads, being stressed, overworked, and fatigued in general, and not being able to provide the type of care that really needs to be provided to the people that you're serving. That's definitely a challenge. A place where I feel like we could grow, or there's opportunities for growth. We did talk about this, or this was part of the reading this week, but talking about AI and the chatbots. I think that is an area for growth, and it's already becoming a huge impact in the field of, psychology, and being able to help people in need at that current moment, because they may not have access to a psychologist or a therapist or a social worker. So these chatbots are kind of stepping into that role. A lot of it is still being tested and tried, but there have been some promising things with the research that's being done. Also, some scary things in my opinion. um, but I think it could serve a positive purpose and help fill a need where there's a gap in care because a lack of feet on the ground. So I think it could serve a purpose in a very small scope. Um, Definitely not at a point of, offering deep therapeutic care because it's not a human. But in moments of high stress and moments of a panic attack, it has shown, at least from the article that we read for this week, that there is some hope there. There's some good stats on how AI is helping people in those moments. So that's definitely a promising area. Yeah. So that's about it. That was pretty much everything that I had to say on that. So yeah, that's it. That's all I got. Thanks for tuning in, and I'll see you next week. Bye.